A stroke is one of the fastest and most dangerous medical emergencies a senior can face. It arrives suddenly, without mercy, and in those first few minutes, every second matters. Today, the goal is simple: to teach you the life-saving response that can protect your brain and your future. A stroke is essentially a shutdown of blood flow to the brain. When blood doesn't reach those delicate cells, they begin to die, quickly. But here's the truth most people never hear. The first 3 minutes can change the entire outcome. If you can recognize a stroke instantly, act without hesitation, and take the right steps, you can dramatically reduce long-term damage. Your actions in those early moments can make the difference between recovery and lifelong disability. This is not just medical knowledge. This is survival knowledge, and every senior deserves to know it. Recognizing a stroke within seconds is one of the most powerful actions a senior can take because the brain begins to lose millions of cells the moment blood flow is interrupted. The key is to stay calm, observe carefully, and use the simple FAST method, a tool designed to help anyone identify stroke symptoms quickly. Start by looking at the face. Ask the person to smile. If one side droops even slightly, it is an immediate warning sign. Next, check the arms. Ask them to raise both arms. If one arm drifts downward, feels weak, or cannot be lifted at all, this strongly suggests a stroke. Then listen to the speech. Ask the person to repeat a simple sentence. Slurred words, confused responses, or difficulty speaking clearly indicate that the brain is being affected. These signs are often subtle at first, but even the slightest change should be taken seriously. The final step is time, and this is the most critical part. The moment you see any of these signs, even if they last only a few seconds and seem to disappear, act immediately. A stroke can come and go in waves, but every moment lost increases the risk of permanent brain damage. Seniors should memorize this method, practice it mentally, and teach it to family members so that no second is wasted when it matters most, calling emergency services. The very moment a stroke is suspected is the single most important decision in the entire response process, because no home remedy, no waiting period, and no personal transportation can replace the speed and precision of trained medical professionals. When a stroke begins, a dangerous blockage or bleeding is already affecting the brain, and every minute that passes allows more brain cells to die. Many seniors lose time by calling a family member first or trying to drive themselves to the hospital, but this delay can cost mobility, speech, independence, and even survival. Emergency teams are equipped with specialized tools, medications, and immediate communication with hospitals that prepare for stroke patients before they even arrive. The faster the call is made, the faster the brain receives life-saving attention. When symptoms appear, dial emergency services before doing anything else. Stay on the line, answer questions clearly, and follow instructions while help is on the way. Avoid letting the person walk, move around, or attempt to get into a vehicle, because stroke symptoms can worsen suddenly, leading to falls or unconsciousness. Emergency responders know exactly how to stabilize the patient, provide oxygen if needed, and transport them safely while alerting the hospital to activate the stroke team. This simple, immediate action gives doctors the precious minutes they need to perform critical procedures when the patient arrives. Keeping a person completely still and calm during a suspected stroke is essential, because the brain is already under severe stress, and any additional physical or emotional strain can worsen the damage. When a stroke occurs, blood flow to part of the brain is either blocked or interrupted by bleeding, and the body immediately reacts with confusion, weakness, dizziness, or loss of control. Movement during this fragile moment can increase blood pressure, disrupt already weakened circulation, and trigger sudden worsening of symptoms. The safest approach is to guide the person gently into a comfortable sitting or lying position, preferably with the head slightly elevated to reduce pressure in the brain. Reassure them in a steady, confident voice, because panic can elevate heart rate and blood pressure, making the situation more dangerous. Encourage slow breathing and keep the environment quiet and steady. Do not allow the person to stand, walk, or move unsupported, as their balance may be compromised, increasing the risk of falls or further injury. Loosen any tight clothing that may restrict breathing or circulation, such as collars or belts, to help the body remain relaxed. Surrounding individuals should avoid crowding or overwhelming the person, and instead focus on creating a sense of safety. These calm, controlled moments help protect the brain from additional stress and give emergency teams a more stable patient when they arrive, identifying the exact time stroke symptoms first appeared. is one of the most critical pieces of information needed during an emergency because modern stroke treatments depend entirely on this time. When a stroke occurs, doctors must determine whether the patient is eligible for clot, busting medication, or advanced procedures that can restore blood flow, and these treatments are only safe and effective within specific time windows. If the starting time is unknown, doctors may be forced to withhold life-saving interventions to avoid the risk of dangerous bleeding. This is why the moment symptoms begin, even if they seem minor or disappear after a few minutes, must be remembered with complete accuracy. The onset time includes the first appearance of facial drooping, slurred speech, arm weakness, sudden confusion, or any sudden neurological change. If the person wakes up with symptoms, note the last time they were seen normal, as this becomes the best estimated starting point. Communicate this time clearly to emergency responders and repeat it at the hospital, because multiple teams will ask to confirm it. Seniors and caregivers should get into the habit of checking the clock the instant something feels wrong, as hesitation or panic can cause people to lose track of time. This simple act of observation gives doctors vital guidance and ensures the patient receives the fastest, safest, and most effective treatment possible. Never giving food, water, or medication during a suspected stroke is critical because the body's ability to swallow becomes impaired almost immediately, even if the person appears alert or insists they feel fine. A stroke disrupts the brain's control over muscles in the mouth and throat, making swallowing unpredictable and unsafe. When someone is given water, pills, or food during this vulnerable moment, it can slip into the airway instead of the esophagus, leading to choking, aspiration pneumonia, or a complete airway blockage at the exact moment the brain is already in crisis. Many well-meaning family members try to offer water to calm the person or give aspirin in hopes of thinning the blood. But this can be extremely dangerous without medical confirmation, because certain types of strokes involve bleeding, and aspirin can make the bleeding worse. Even small sips or tiny pieces of food can put the patient at risk, so it is essential to keep the mouth completely clear until medical professionals evaluate their ability to swallow safely. Focus instead on keeping the person comfortable, monitoring their breathing, and ensuring they remain still while help is on the way. If the person asks for water or medication, gently explain that it must wait until trained responders arrive. Protecting the airway at this stage is one of the most important steps in preventing complications, and ensuring the patient reaches the hospital in the safest condition possible. Watching a person's breathing and staying with them during a suspected stroke is essential, because their condition can change suddenly and without warning. As the brain loses normal function, the muscles responsible for breathing, swallowing, and airway control may weaken, causing slow, irregular, or noisy breaths. Staying close allows you to notice these changes immediately and respond calmly. If the person becomes drowsy, confused, or less responsive, gently position them on their side to keep the airway open and prevent choking if saliva or vomit occurs. This side position also helps maintain steady breathing and reduces the risk of the tongue blocking airflow. Continue observing the rise and fall of the chest, the sound of the breath, and any signs of distress. Avoid shaking or startling the person, and instead use a steady, reassuring tone to help keep their stress levels low, which supports more stable breathing. While staying nearby, make sure the environment around them remains safe and quiet. Remove any objects that could cause harm if symptoms worsen, and avoid letting the person attempt to stand or walk. Staying present provides emotional stability, lowers panic, and ensures that if their condition changes, you can immediately inform emergency responders. This calm, attentive presence offers both physical protection and psychological comfort during a moment when the brain is under intense strain. A stroke arrives without warning, but your response does not have to. The steps you've learned today are simple, practical, and proven to save lives when every second matters. Recognizing the signs, acting immediately, keeping the person calm, noting the exact time, avoiding food or medication, and staying close while watching their breathing can protect the brain long before medical help arrives. These actions may feel small, but together they create a powerful shield during one of the most dangerous emergencies a senior can face. Knowledge is the one tool you can carry everywhere, and now you have it. Share it with your family, teach it to those around you, and keep it fresh in your mind. Because the moment a stroke strikes is the moment this information becomes priceless. You're not just learning health tips, you're preparing yourself to save a life, and that life could be your own or someone you love.